Have you ever checked your blood pressure, looked at those two numbers on the screen, and wondered which one is the real danger? Most people over 60 focus on the top number. Others worry only about the bottom number. But what if I told you that misunderstanding these numbers could put your heart, brain, and even your life at risk? Today, we're uncovering one of the biggest blood pressure myths affecting seniors around the world. As a cardiologist, I've met countless patients who proudly told me their blood pressure was fine, only to discover that one hidden number was silently damaging their arteries every single day. Here's the truth, blood pressure isn't just a single measurement. It's a story your body is telling. The top number, called systolic pressure, measures the force against your artery walls when your heart beats. The bottom number, known as diastolic pressure, measures that force when your heart rests between beats. For decades, many people believed both numbers were equally important. While both matter, research has shown that after age 60, one number often becomes a much stronger predictor of heart attacks, strokes, kidney disease, and even dementia. Why does this happen? As we age, our arteries naturally become stiffer. Think of a brand new garden hose compared to one that's been sitting in the sun for 20 years. The older hose becomes less flexible. The same thing happens to blood vessels. When arteries lose their elasticity, the pressure created with each heartbeat rises dramatically. This means many seniors develop a condition called isolated systolic hypertension. Their bottom number may look normal, but their top number keeps climbing higher and higher. And that's where the danger begins. A blood pressure reading of 165/75 may not seem alarming to some people because the bottom number looks good. But that elevated top number can place enormous stress on the heart, brain, eyes, and kidneys. Over time, this damage accumulates silently without causing obvious symptoms. That's why some people feel perfectly healthy right up until the moment they suffer a stroke or heart attack. In the next part, I'll reveal which blood pressure number cardiologists watch most closely in adults over 60 and why it may be far more dangerous than most people realize. So, which blood pressure number is the most dangerous for seniors over 60? For most older adults, the answer is the systolic pressure, the top number. This surprises many people because they were taught to pay attention to both numbers equally. But as we age, the top number often becomes the strongest warning sign of future cardiovascular problems. Let's look at why. Every time your heart beats, it pushes blood through your arteries. When those arteries are healthy and flexible, they expand easily to handle the surge of blood. But over the years, arteries can become stiff due to aging, high cholesterol, diabetes, smoking, lack of exercise, and chronic inflammation. When arteries lose flexibility, the heart must pump harder to move blood through the body. As a result, the systolic pressure rises. This increased pressure creates tiny injuries inside artery walls. Day after day. Month after month. Year after year. The scary part is that these injuries often happen without pain. You don't feel your arteries becoming damaged. You don't feel plaque building up. You don't feel your blood vessels narrowing. Yet the risk continues growing in the background. Studies have repeatedly shown that elevated systolic blood pressure is strongly linked to strokes, heart attacks, heart failure, kidney disease, and cognitive decline in older adults. In fact, many seniors believe they are safe because their diastolic pressure remains normal. A reading like 170/72 might seem confusing. The bottom number appears healthy, but the top number signals a serious problem that should never be ignored. Think of systolic pressure as the force of a hammer striking a wall. If that force is too high thousands of times every day, eventually the wall begins to crack. Your arteries experience that same stress. Now, here's something even more concerning. Many seniors dismiss elevated readings because they feel fine. No headaches. No dizziness. No chest pain. No warning signs. But high blood pressure has earned the nickname, the silent killer, for a reason. It can quietly damage the heart and blood vessels for years before symptoms appear. By the time symptoms finally develop, significant harm may already have occurred. That's why cardiologists don't wait for symptoms. We focus on the numbers because the numbers often reveal danger long before the body does. And in the next part, I'm going to expose a common blood pressure mistake that millions of seniors make every day, one that can lead to inaccurate readings and a false sense of security. One of the biggest mistakes seniors make is believing a single blood pressure reading tells the whole story. It doesn't. In fact, I've seen patients panic over one high reading and others completely ignore a dangerous pattern because they happen to get one normal result at the doctor's office. Neither approach is safe. Blood pressure naturally changes throughout the day. It can rise when you're stressed, rushing to an appointment, drinking caffeine, arguing with someone, or even worrying about the blood pressure test itself. This is why cardiologists look for trends, not isolated numbers. Imagine stepping on a scale after a large meal. That number alone doesn't define your health. The same principle applies to blood pressure. For seniors over 60, consistent readings are what matter most. Unfortunately, many people unknowingly measure their blood pressure the wrong way. Some cross their legs. Some talk during the measurement. Others check it immediately after climbing stairs or walking around the house. Even a full bladder can affect the result. These small mistakes can change readings enough to create confusion about your true cardiovascular risk. To get the most accurate measurement, sit quietly for at least 5 minutes before testing. Keep both feet flat on the floor. Rest your arm at heart level. Avoid talking during the measurement. If possible, take 2 or 3 readings about 1 minute apart and record the average. This simple habit can provide a much clearer picture of what's really happening inside your body. Now let's talk about another number that cardiologists pay close attention to in older adults. It's called pulse pressure. Most people have never heard of it. Pulse pressure is the difference between the top and bottom blood pressure numbers. For example, if your blood pressure is 160/70, your pulse pressure is 90. Why does this matter? A widening gap between the systolic and diastolic numbers often signals increasing stiffness in the arteries. The larger that gap becomes, the harder the cardiovascular system may be working. Many studies have found that unusually high pulse pressure is associated with greater risks of heart disease, stroke, and other complications in seniors. That's why a reading of 170/70 may actually concern a cardiologist more than many people realize. The top number is high, and the large gap between the numbers suggests the arteries may be losing flexibility. But here's the surprising part. A very low diastolic pressure can also create problems, especially when blood pressure medications lower it too much. And in the next part, I'll explain why a bottom number that seems good may sometimes be dangerously low for seniors over 60. Now here's something that surprises many seniors. While high blood pressure is dangerous, a diastolic pressure that's too low can also create serious concerns. Remember, the bottom number, diastolic pressure, represents the pressure inside your arteries when the heart relaxes between beats. During this resting phase, something extremely important happens. Your heart muscle receives its own blood supply. That's right. The heart doesn't just pump blood to the rest of the body. It also needs oxygen-rich blood flowing through its own arteries. Much of that blood flow occurs while the heart is resting between beats. If the diastolic pressure falls too low, the heart may not receive the blood flow it needs. For some seniors, especially those with existing heart disease, this can become a real problem. I've seen patients celebrate because their blood pressure dropped from 160/90 to 125/55. At first glance, that sounds fantastic. But sometimes a diastolic pressure in the 50s can leave certain older adults feeling tired, weak, dizzy, or lightheaded. This doesn't mean low diastolic pressure is automatically dangerous for everyone. Many healthy people naturally have lower readings and feel perfectly fine. The concern arises when the bottom number becomes very low while the top number remains elevated, creating an extremely wide pulse pressure. For example, a blood pressure reading of 165/55 is not necessarily reassuring. The systolic pressure remains high, indicating ongoing strain on the arteries, while the low diastolic pressure may reduce blood flow to critical organs in some individuals. This is why blood pressure management is never about chasing the lowest possible numbers. It's about finding the safest range for each person's age, health conditions, medications, and overall cardiovascular risk. Unfortunately, many seniors make the mistake of adjusting medications on their own after seeing a few readings they don't like. That can be risky. Stopping medication suddenly or changing doses without medical guidance may cause blood pressure to rebound sharply, increasing the risk of heart attack, stroke, or other serious complications. The goal is balance, not numbers that are too high and not numbers that are too low. So if both extremely high systolic pressure and excessively low diastolic pressure can be problematic, what blood pressure range should seniors actually aim for? In the final part, I'll reveal the targets many cardiologists use, the warning signs you should never ignore, and the simple daily habits that can help protect your heart, brain, and blood vessels for years to come. So, what blood pressure numbers should seniors over 60 actually aim for? The answer may be simpler than you think. For many older adults, cardiologists generally want to see blood pressure controlled well below dangerously high levels while avoiding readings that are excessively low. The exact target can vary depending on age, overall health, medications, kidney function, diabetes, and existing heart disease. That's why there is no one-size-fits-all number. However, one thing is absolutely clear: consistently elevated systolic pressure should never be ignored. If your top number regularly stays in the 140s, 150s, or higher, it's time to have a serious conversation with your healthcare provider. Waiting for symptoms is a mistake because high blood pressure often causes damage long before warning signs appear. And what warning signs should never be ignored? Seek immediate medical attention if you experience sudden chest pain, severe shortness of breath, sudden weakness on one side of the body, difficulty speaking, loss of vision, severe confusion, or an unusually intense headache. These can be signs of a medical emergency requiring urgent treatment. But here's the encouraging news. Many of the most powerful blood pressure treatments don't come from a pill bottle. They come from daily habits. Regular walking can improve circulation and help maintain healthier blood pressure levels. Reducing excess salt intake may help lower pressure on the arteries. Eating more fruits, vegetables, whole grains, and lean protein supports cardiovascular health. Maintaining a healthy weight can reduce the workload on the heart. Getting quality sleep and managing stress can also have a surprisingly powerful effect on blood pressure control. And don't underestimate the value of monitoring your blood pressure at home. The more you understand your numbers, the better equipped you are to protect your health. So let's return to the question we asked at the beginning. Which blood pressure number is most dangerous for seniors over 60? For most older adults, the systolic pressure, the top number, deserves the closest attention because it often becomes the strongest predictor of strokes, heart attacks, heart failure, kidney disease, and other serious complications as we age. But the real lesson isn't about focusing on one number alone. It's about understanding the full picture. Know your numbers. Track them consistently. Work closely with your healthcare provider. And take action before symptoms appear. Because when it comes to blood pressure, the most dangerous number is often the one that's ignored. If you found this information helpful, make sure to subscribe, turn on notifications, and join us for more heart health insights designed to help you stay stronger, healthier, and more informed at every age. Until next time, take care of your heart, because it takes care of you every second of every day.